Every year, Bill and Melinda Gates release their annual letter detailing what we can do for better health and a better future. This year's letter is titled "The Year Global Health Went Local" and focuses on the impacts of COVID-19. Among many important issues, the letter stresses how remarkable it is that a vaccine has already become available, and equally stresses how important it is to understand that even on this accelerated timeline, safety standards were not compromised. We've covered this before, emphasizing the roles of advanced technology, previous research, and concentrated resources in our ability to reach this milestone so quickly. However, vaccine hesitancy remains elevated. As the vaccine continues to roll out, expected side effects are starting to appear. Some of the less prevalent but seemingly scarier ones receive heavy media coverage, and there's some concern that scientists and medical professionals haven't communicated enough about these. Providing context with reports of side effects leaves less room for disinformation and scare tactics to infiltrate the conversation. That's the topic of this week's Healthcare Triage. Side effects are a common occurrence in the world of medicine. The reason we do large trials with new medicines, like those we did with the new COVID vaccines, is not only to determine efficacy, but also to detect side effects and determine if they are tolerable. Overall, the side effects of an approved drug are, in most cases, thought to be more acceptable than the effects of the condition or disease that it treats. As reported by Wired and other sources, people receiving the vaccine have definitely experienced some. This is not surprising. The companies developing the vaccines have reported these as well. Trial participants experienced symptoms including fever, chills, fatigue, headaches, and muscle and joint pain. While these symptoms are often mild and expected to pass within a couple of days, other reactions have been reported that, despite their relatively low levels of occurrence, have people feeling a bit more alarmed. These were, of course, reported heavily in the media and included things like severe allergic reactions and brief facial paralysis called Bell's palsy. Allergic reactions, especially when severe, can be scary, but with proper monitoring, they can also be handled very effectively. It's important to note that these reactions are not a sign that something is wrong with the vaccine. They're simply an overreaction of the immune system to a foreign substance, a reaction that is not unfamiliar to us, even in contexts outside of medicine. Severe allergic reactions are known to occur in response to natural things too, like eggs, nuts, and bees. As I pointed out in a recent New York Times article, around 1 in 10 Americans report an allergic reaction to penicillin, and between 1 in 2,500 and 1 in 5,000 experience anaphylaxis, which is a severe and life-threatening allergic reaction. Despite this, I and other pediatricians regularly prescribe penicillins because most reactions are minor and we can handle the ones that are major, and the benefits outweigh the harms. As for Bell's palsy, this sounds much scarier than it is. It's a temporary weakness or sometimes mild paralysis, usually on one side of the face. It appears suddenly and generally improves after a few weeks with or without treatment. Permanent and/or severe cases are extremely rare. It affects around 40,000 people in the United States each year and has been linked to viruses like herpes, chickenpox, and shingles, mono, mumps, the flu, and others. Importantly, 25 to 35 per 100,000 people get Bell's palsy annually in the United States, which is a rate more frequent than that reported for COVID vaccine trials. You probably also heard of the nurse who got his vaccine and then tested positive for COVID about a week later before receiving his second shot. He did not contract COVID from the vaccine, which does not contain any live virus. We know that it takes time for immunity to build up after the first dose, and we know that substantial immunity is achieved only after the second dose. We also know that these shots are not 100% effective. They're great, but they aren't 100% great. What we don't know is when he contracted COVID. It could have been before or after his first shot. We obviously haven't been clear enough about any of this. And of course, there's the story of the nurse Tiffany Dover, who fainted after receiving her vaccine. There are even some rumors that she died. This is not true. She's alive and well, and this kind of reaction is not all that rare. In fact, when she recovered, she said it was common for her to pass out in such situations because she has an overly active vagal response. Vasovagal syncope occurs when a trigger such as blood, pain, or emotional distress causes a sudden drop in heart rate and blood pressure that results in fainting. This is more common than you might think, and beyond the risk of a fall injury when fainting, it's harmless. It's happened to me multiple times in my life. Using data from their ongoing project aimed at tracking the public mood about COVID-19 vaccination, the Kaiser Family Foundation reported in December that 59% of respondents listed concerns about side effects as one of the major reasons they were hesitant to get the vaccine. We think better communication would help to mitigate this concern. When dramatic side effects are not discussed in context, it's reasonable to expect that people will get scared. It's also unfortunately expected that some people will take advantage of that fear to stoke vaccine hesitancy and further spread misinformation. If we were more explicit about how these reactions compared to other allergic reactions we encounter in the United States each year, that context could help people make more rational judgments when they encounter stories about severe side effects. If we talk to people about their risk for allergic reactions and how to approach the vaccine if they've had issues in the past, and talk to them about how to weigh the risk of vaccination with the risk of disease, they might feel safer. As I've said before, we've had some communication issues throughout the pandemic. Let's try and do better with the vaccine so we can end this. Making the vaccine available to as many people as possible is critical to that goal and is important for global health, which, as the title of the Gates letter reinforces, holds a deeper meaning now. In the past year, a global event has been reflected locally in ways most of us have never experienced before. And of course, large-scale, equitable distribution of the vaccine will be critical. It's also something we knew would be difficult. Fortunately, many are hard at work to achieve this, including the Gates Foundation. As detailed in their letter, they've been working with partners on developing and manufacturing vaccines simultaneously rather than sequentially, and are working with both manufacturers and partners to deliver the vaccines cheaply and widely. As written by the Gates, COVID-19 anywhere is a threat to everywhere. And lastly, we'd like to touch on another major point in the Gates letter, looking to life after the pandemic, specifically to prioritizing equity, the lack of which has been laid bare by COVID-19, and preparing now to stop the next pandemic. There are several important ways that we can achieve both of these objectives. We'll include a link to the Gates annual letter in the description below if you're interested in learning more, or you can head to gatesletter.com to read it yourself. Hey, did you enjoy this episode? You might enjoy this previous episode on COVID reinfection. We'd like to thank the Bill and Melinda Gates Foundation for partnering with us on this video. You too can partner with the show by going to patreon.com/healthcaretriage and help make the show really work even during a global pandemic. We'd like to especially thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral Sam.